So I just wanted to follow up on my latest mental health video. I kind of got a little emotional there. But I just wanted to really talk some more about this because mental health is a big deal for me. It's very important, and I just want to make sure and encourage everybody to pay attention. When it comes to mental health, there's many disparities, and it's saddening. So I have to ask, certain questions, especially for women, but especially for women of color. Are you even going in for your annual checkups? And are you even being asked the right questions by your healthcare providers or the nurses that may be screening you? And then if you are being asked the right questions, are you answering them truthfully? More people are definitely dealing with mental health incidents, issues, experiences, or, situations that are definitely impacting our overall mental well-being. Primary care providers have demonstrated or presented in the recent research that more people or more patients have been dealing with mental issues when they come in for their visits. And it's requiring more of them. And they try to, put forth time to screen and then really help each patient get down to the root of the problems, but they don't necessarily have time to kind of cover it all. But I want to say that that's definitely a good start. That's definitely a good starting point. So mention to your primary care doctors when you go in to get the conversation started. I screened positive on my latest depression screening at my last checkup, and I am not surprised at all. I know that I'm dealing with a lot. I know I just had some things happen to me that had me down and had me in a funk. And no matter what I was doing, I wasn't feeling any better. Now, this got my attention, and it got my provider's attention. But of course, all he could say at the time was, hey, you're dealing with a lot. You're a smart woman, and, you need to just focus on being more present, just being in the moment and try not to stress. And yes, that was great advice, but it did not really get down to the root or address what I could do to do better. So for everyone out there, I encourage you to just, first of all, be okay with not being okay. Know when to say something. We are all going through something, and when the road gets tough and you just don't feel right, no matter what you're doing, then it may be time for you to ask for help. And sometimes we either don't realize when we are not doing okay, or we do not dare to mention it. It's like we see that as a sign of weakness if we say that we're not feeling well, or something's going through our head that's making us feel down, or I just want you to know you do not have to carry it all. You do not have to fix it all, and you definitely don't have to be perfect. There's no such thing. Seek help. Talk to someone, and I don't mean talking to family members or friends, although that's okay. That's definitely a starting point too. But some things are better handled by a licensed professional. And when it comes to insurance coverage, try not to let this be a problem or an excuse to not seek help as well, because there are so many free resources that are available. I've been fortunate enough to maintain throughout my entire life, and every time I've been dealing with mental health issues, I've been fortunate to maintain off of medications. In general, I use vitamins and supplements such as vitamin D and B vitamins and definitely vitamin C as well to kind of maintain my zen and keep me calm. I believe everyone should do what's best for them with the guidance of your healthcare provider, of course. Pay attention to your body and how you are genuinely feeling, because this really does matter, and it makes an impact. And there's that saying, when you look good, you feel good. I mean, thinking about your self-esteem, for instance, all of that definitely matters. Everything I've already mentioned in terms of maintaining a healthy gut will help to balance and improve your mental health, because certain things that you eat causes certain chemical reactions inside of you that can contribute to that being off feeling. So it's really important that you try to eat clean, preferably a Mediterranean diet. Research has shown that the Mediterranean diet has been linked to better mental health. That diet, look it up, but it contains a lot of healthy fats, a lot of healthy oils, protein, fiber, prebiotic foods, and other things that you could do to stay hydrated. Make sure you get enough sleep. Microbiome Labs does have a probiotic blend that's specifically designed for keeping your zen and helping you to stay cool. And then they also have another blend that helps with sleep. These are some options that you can try. I provided a link below for you to learn more about that. But you definitely want to do anything that you can to maintain your mental well-being. Exercising, just getting outside for 20 minutes each day, whatever you could do, breathe some fresh air. Take those moments like I've already recommended to just breathe and to just be present, to just ask yourself, how am I feeling today? If you don't do it, you can't expect someone else to do it. So you got to start with yourself first. And always remember, like I said, that you don't have to carry it all. It's okay when you're not feeling your best. It's okay to talk to someone. And then if you are talking to someone who seems like they're struggling and they could use more help, get them connected. Always be an ear, but don't try to help them through things that you know is not within your scope. Now, until next time, be well.